We are at LINNC 2026 in Paris, France, and my name is Jens Fieler. I'm director of the Department of Neuroradiology at the Hamburg University Hospital in Hamburg-Eppendorf, and it's my pleasure to be here with Dr. Pascal Jabbour from the Jefferson University, from the Neurovascular Division, and he's the head of the Neurovascular Division. And we are here to discuss our latest study findings of the Contour device. Pascal, can you summarize briefly what your observations are with the NECC study? What is the NECC study anyway?
Thank you, Jens. So the NECC study was a prospective single-arm IDE trial about the new Contour device. I was the national PI with Dimitrios Lopez in the US, and the target was to enroll 250 patients, ruptured and unruptured aneurysm. We finished enrolling a year ago, and now we're wrapping up with a 1-year follow-up. And we recently, I presented the interim preliminary results and data from the NECC trial. The preliminary data showed that the occlusion rate with the Contour device was adequate occlusion rate close to 76%, but this is just not all the data, because we were still waiting for a 1-year follow-up from at least 40 more patients. Yeah. It showed that the Contour device is effective in treating brain aneurysm and safe. We had the majority of the patients were unruptured, and there was a small percentage of ruptured aneurysm. We were able to deploy the device without any problem in the majority of the cases. And in around 75% of the time, it was one device that was placed without changing for any reason, like sizing issues. It was safe, and the complication rate was overall 3%. And there was zero mortality related to the device. Now, there is some limitation so far, which is, first of all, that's not the final results. And second, that the majority of the aneurysms that were treated were more on the smaller side. Few aneurysms where we used the bigger device. So the majority of the devices that were used were the 5, 7, and 9. So this is so far what we are allowed to share, because as you know, the FDA doesn't want us to share more than that until hopefully when we submit officially and we have the final results from it. But so far, the preliminary results of the trial that the Contour device is effective in treating brain aneurysms with a safety profile. We also conducted also a meta-analysis on 483 patients treated mainly in Europe, because we cannot use the US patients because they were trial patients. This was published in JNIS that showed an adequate occlusion rate of 93%, with the same safety profile and 0% mortality rate related to the device, with improvement of the occlusion with time. And I think you're going to be talking mainly about that in your trial. So from our standpoint, as a conclusion, as I said, from the so far the preliminary data of the trial and the meta-analysis, that the device is promising. And but at the end, we need to wait for the final results of the trial before, claiming scientifically and officially anything more. At this point, I'm interested in hearing from you about your trial, that the study that you headed in Europe about the Contour trial. So.
What you mentioned in the majority of currently published study on the NECC. On the Contour device, including the NECC study, the minority is in ruptured aneurysm. And there is this question, is the Contour effective in ruptured aneurysm? Are there any signals that the Contour should be used only in unruptured aneurysms? And the answer is no. That was the major question that we were trying to answer with the Contra study. And the Contra means Contour for the treatment of ruptured aneurysms. And we collected data from 83 patients, 83 aneurysms from 6 European centers, so rather high volume centers that are comfortable with using the contour also in ruptured aneurysms. And essentially what we found is there's a relatively high occlusion rate that is even beyond. So the complete occlusion rate at 12 months was something like 86%, which is a bit much. But we had incomplete follow-up only, so I wouldn't count on it 100%. But we had no signal whatsoever that there were any issues in the acute stage. So there was, I can just echo what you were saying. So the device is also safe and effective in the acute situation, and there is no hint for any risk here. That's the point number one. And the other point is we introduced a new classification system for positioning of intrasaccular devices, because we are all measuring aneurysm occlusion, but the stability of the device as such is a different dimension. And this is what we kind of as a sideshow we're trying to analyze, how stable is the contour, and it shows that it's very stable. So the coverage of the aneurysm neck, there was no change whatsoever in the first 6 months. Which is quite encouraging. So just what you just said. Yeah. I think it's really difficult to compare occlusion rates between core labs. You mentioned in your meta-analysis a very high adequate occlusion rate. This seems to be in the interim analysis of neck somewhat lower. How do you see that?
Yeah. So I think, as I said, there are still a big number of patients that we don't have the 1-year follow-up angiogram. So we'll see how this gonna project. But again, as you know, in controlled trials, we are more strict in looking at results, and the inclusion criteria and exclusion criteria are more strict as compared to a meta-analysis where it's not homogeneous, and then we're looking at case series, small series, sometimes very heterogeneous. So I think this is how I can explain it. So I have a question for you. Right now, let's say a 7 millimeter ruptured ACOM aneurysm. Would you place contour only, or would you combine it with coils? And when in your practice would you combine contour with coils?
Yeah, great question. So formally, there is no indication for using additional coils with the contour. But of course you can do anything. And the data from Contra didn't show any positive effect of additional coils plus the contour. The occlusion rates in the long run were better, but of course at the end of the procedure, if you place coils, you have a higher occlusion. I think that's for sure, and you feel more comfortable with it. So I think I would try and avoid it, but I wouldn't be too hesitant to use it if if the gut feeling says maybe rather a few coils. But that's my personal opinion. I'm not speaking on behalf of any company or so. It's just what we do.
Would you think of it like deciding if you would add some coils in a flow diversion case?
Kind of like that.
Yeah.
Yes. But I'm also reluctant with coils in the flow diversion case. Yeah. I'm aware there's a big spectrum, spectrum of ideas. Yeah. So in general, I think it's very good to have those data, because there's a lot of discussion about is it good, is it bad, who has which experience, and that's why I believe it's also worth mentioning that Stryker committed to a registry for any intrasaccular device. It's called Delivery, and they are using the Trenza, the Contour, and the neck stent. It's anything can be used for, and I think this is going to bring quite a bit of interesting add-on information. I wish they would have done it earlier. Would have saved us a lot of discussion. But that's just how it is, and I'm really grateful that they are supporting this kind of research. I think if I understand correctly what you were explaining about neck and what my experiences are with Contra, is that the contour is effective and it's safe. And then the big moment comes when the neck data are presented. Exactly. And you are the big PI. I can't wait for you presenting the data.
Thank you. With Dimitrios Lopez.
Yes, with Dimitrios Lopez, of course.
So I think in the coming 6 months we will wrap up everything.
Okay. I can't wait for it.
Yeah, great.
Okay.
Thank you.
Thank you.